Mesothelium is a squamous epithelial layer that covers many internal organs and systems, including the lungs, the abdominal cavity, and the heart. Mesothelioma is a malignant cancer affecting this layer of tissue, in which genetic mutation causes rapid and uncontrolled growth of mutant cells. Pleural mesothelioma is the most common form of the disease. In more than 80% of cases, it is caused by inhaling airborne asbestos fibers on a long-term scale. The fibers get embedded in the lung tissue and mesothelium, where they can cause inflammation and later mutation. This is the process that causes the formation of tumors in the lungs lining. Peritoneal mesothelioma can be caused by swallowing the asbestos fibers, which lodges them in the chest cavity or genitals. When the fibers travel through lymph nodes, they can attach in the lining of the heart, causing pericardial mesothelioma. A virus called simian virus 40 has also been found to have a connection to the cancer because over 50% of mesothelioma patients were found to have the simian virus. The evidence has shown that this virus doesn't cause mesothelioma, but having the virus increases the risk factor for contracting the disease. Symptoms of the disease include difficulty breathing, persistent cough, unusual lumps, pain in the abdomen, constipation, fatigue, and weight loss. The pain and difficulty breathing are due to a buildup of fluid in cancerous tissue in the lungs. When a patient experiences symptoms of the disease, a doctor can diagnose it with an X-ray, a CT scan, or a biopsy. Mesothelioma is usually not diagnosed until the later stages of the disease because its symptoms can be difficult to detect. This makes fewer treatment options viable and makes a cure unlikely. At this deadly terminal stage, doctors most often try to alleviate the pain and discomfort that come from the symptoms of mesothelioma to make the rest of the patient's life less painful. Treatments include the insertion of a tube in the chest cavity to drain excess fluid and removing cancerous tissue to alleviate pressure in the chest. Patients who wish to attempt to cure the disease can undergo radiation and chemotherapy to control growth of cancerous tissue or undergo surgery to remove the tumors. In extreme cases, patients can have an entire lung removed to prevent further growth of the cancer. Most patients choose combinations of these treatment options to control the spread of the disease.